She has been avoiding cheese for 3 years, not because anyone told her specifically to stop, just because it seemed like the right thing to do when managing blood sugar. It is dairy. It has fat. It seemed like something that belonged on the careful side of the line she drew when her doctor first mentioned prediabetes. She reads about it occasionally and finds conflicting things, so she keeps avoiding it. What she does not know is that the food she gave up may have been one of the more protective choices she could have kept. The relationship between dairy fat, cheese specifically, and blood sugar management is one of the most misunderstood areas of nutritional medicine for older adults, and it is almost never explored with any nuance during a standard appointment. The prevailing message for decades has been that fat is something to minimize, and since cheese is high in fat, the implication has been that cheese is something to avoid for people managing glucose. But the research, particularly in the past decade, has shifted considerably on this question. And for adults over 60, managing prediabetes or type 2 diabetes, the practical implications of that shift are meaningful. There are cheeses that, when eaten in appropriate amounts and in the right context, do not spike blood sugar and may actually support better glycemic control. Understanding which ones, how much, and why is the conversation this video is meant to have. My name is Dr. Noris. I am an endocrinologist and diabetes specialist with 19 years of clinical experience with a specific focus on nutritional management and metabolic health in adults over 60. What motivated this video is the number of patients unnecessarily restricting foods that could be allies in their blood sugar management because they were never given the specific information they needed to make confident choices. After 60, the metabolic picture around dairy and blood sugar becomes more nuanced in specific ways worth understanding. Cheese, unlike most other foods people associate with blood sugar concern, has a glycemic index close to 0, meaning its direct effect on blood glucose is minimal. The lactose in milk, which is the sugar that raises blood sugar in dairy products, is largely consumed during the fermentation and aging process that produces most cheeses. What remains in aged cheese is predominantly fat and protein, with very little residual lactose. Protein, particularly from dairy, stimulates insulin secretion in a way that is independent of glucose. It is insulinogenic without being glycemic, which means it can support glucose management without raising blood sugar itself. Fat further slows gastric emptying, meaning that when cheese is eaten alongside carbohydrates, it blunts the speed at which glucose enters the bloodstream. Think of fat and protein together as a speed governor on the glucose delivery system. They do not reduce the total amount of glucose from the meal, but they extend the window over which it arrives, flattening the spike. After 60, when pancreatic insulin response is slower and glucose clearance is less efficient, this flattening effect is genuinely valuable. The 5 cheeses I want to walk through today each bring this benefit in different ways, and each has a specific evidence profile worth understanding. Before I walk through them, I want to ask you something. Have you been avoiding cheese because of blood sugar concerns? Or are you still eating it regularly? Just type avoiding or eating in the comments. I want to understand how many people watching this have made the same calculation she made in that opening. The first cheese I want to discuss is aged cheddar, and I want to start here because it is one of the most familiar and one of the most abandoned by older adults managing blood sugar, who assume that strong flavor means something problematic is happening nutritionally. Aged cheddar, meaning cheddar that has been matured for 6 months or longer, has had nearly all of its lactose consumed during the fermentation process. The residual lactose in a 1-ounce serving of aged cheddar is negligible, producing a glycemic index of essentially 0. The protein content of cheddar stimulates glucagon-like peptide 1, or GLP-1, a gut hormone that slows gastric emptying and signals the pancreas to respond to glucose more efficiently, a mechanism that several diabetes medications are now specifically designed to activate. Research from the European Journal of Clinical Nutrition and related dietary intervention studies has documented that full-fat cheese consumption is not associated with increased type 2 diabetes risk, and in some cohorts is associated with modest protective effects. A woman named Theodora, a former civil engineer, who had approached her pre-diabetes diagnosis with the same methodical problem-solving she had applied to structural challenges throughout her career, came to see me having cut every high-fat dairy product from her diet based on a general dietary guideline she had read. Her blood sugar management had not improved as expected, and she had lost a significant source of protein and satiety that had been helping her avoid higher glycemic snacking. Reintroducing 1 to 1.5 ounces of aged cheddar as a daily snack, paired with a few low-starch vegetables, stabilized her post-meal glucose responses and reduced the afternoon hunger that had been leading to less disciplined snacking. The practical fix. 1 to 1.5 ounces of aged cheddar is a portion that delivers protein, fat-mediated glucose buffering, and GLP-1 activation without meaningful glucose contribution. Pair it with something crunchy and low glycemic, cucumber, celery, a few walnuts, for a snack that supports, rather than undermines your blood sugar goals. The second cheese is cottage cheese, and I want to address it specifically because it is widely recommended as a healthy food for older adults, but is consumed in ways that work against its metabolic advantages. Full-fat or 2% cottage cheese has a low glycemic index, a high protein-to-carbohydrate ratio, and a calcium and phosphorus profile that supports bone health and metabolic signaling. The protein in cottage cheese, primarily casein, which is a slow-digesting dairy protein, produces a sustained amino acid release over several hours that supports satiety and steady blood sugar through the morning. The mistake most seniors make with cottage cheese is choosing fat-free versions, which have a higher carbohydrate-to-protein ratio and lose the gastric emptying slowing benefit that fat provides, or eating it alongside high glycemic fruit like ripe banana or sweetened granola that overwhelms its glucose buffering contribution. A man named Bertrand, a former harbor master who had a methodical and systematic approach to every aspect of his health, and who kept detailed notes on his glucose readings, came to see me after noticing that his post-breakfast readings were consistently better on the mornings he skipped his cottage cheese and fruit combination than on the mornings he ate it. The cottage cheese itself was not the problem. The ripe banana he mixed into it was adding 27 grams of quickly digested sugar to an otherwise low glycemic food. Switching to cottage cheese paired with a handful of blueberries or a few strawberries, lower glycemic fruits, produced the consistently good readings he had been expecting from the cottage cheese all along. The practical fix. Choose full-fat or 2% cottage cheese over fat-free versions, and pair it with low glycemic accompaniments. Berries, a few nuts, cucumber slices, or a drizzle of olive oil and cracked pepper are all companions that preserve, rather than cancel its metabolic benefit. The third cheese is one that many people associate with indulgence rather than health, and that is fresh mozzarella, particularly the soft, whole milk variety, rather than the low-moisture processed kind. Fresh mozzarella has a very low glycemic index, a mild flavor profile that pairs well with vegetables and olive oil, and a fat and protein composition that supports glucose buffering in the same manner as aged cheeses, but with a softer texture and a different culinary application. Its combination with tomato, basil, and olive oil, the classic caprese profile, represents one of the most glycemically favorable snack or light meal combinations available to older adults managing blood sugar. The fat from the olive oil and the cheese slows gastric emptying. The tomato contributes lycopene and modest fiber, and the total carbohydrate load of the dish is very low. Research examining the Mediterranean dietary pattern, including analyses from the PREDIMED study published in the New England Journal of Medicine, has documented protective associations between Mediterranean dietary components, including moderate full-fat dairy, olive oil, and vegetables, and reduced incidence of type 2 diabetes and cardiovascular events in older adults. A woman named Solange, a former stage costume designer who had a lifelong appreciation for food as both nourishment and pleasure, and who had been mourning the loss of enjoyable eating since her pre-diabetes diagnosis, came to see me despondent about what she described as a life sentence of bland food. When I introduced the Caprese framework, fresh mozzarella, ripe tomato, fresh basil, good olive oil, eaten as a light lunch, she told me at her next visit that it had genuinely restored her relationship with eating. Her post-lunch glucose readings on Caprese days were among her most favorable. The practical fix. Build a weekly meal around fresh mozzarella, sliced tomato, basil, and olive oil. This is a genuinely satisfying, low-glycemic, Mediterranean-aligned meal that delivers fat, protein, and flavor without a blood sugar consequence. If you are still with me and finding this useful, type the word cheese in the comments right now. It tells me who is staying through, and I want to make sure the rest of this reaches you. The fourth cheese is one that belongs specifically in the conversation about blood sugar, because it has been studied more directly in the context of glycemic management than almost any other variety. And that is Parmesan, specifically aged Parmigiano Reggiano. This is one of the most aged and most fermented cheeses in common use, meaning it has the lowest residual lactose of virtually any commonly available cheese. A 1-ounce serving contains under half a gram of carbohydrate, making its direct glycemic contribution negligible. More relevantly, Parmesan is extraordinarily high in protein relative to its volume. A small amount delivers significant protein density, and its aging process produces free amino acids that are absorbed efficiently and support satiety and metabolic signaling without the caloric density of eating a larger portion of a less concentrated protein source. A man named Rafferty, a former deep-water geologist whose work had required precision in small measurements and who applied that same precision to his health data, came to see me after discovering that his post-dinner glucose readings were consistently lower on evenings when he finished his meal with a small amount of shaved Parmesan over his salad or vegetables, compared to evenings when he skipped it. He had been treating this as a possible coincidence for several months before he brought it to my attention. It was not a coincidence. The protein and fat from the Parmesan were contributing to the glucose buffering effect he was observing. We incorporated it deliberately as a consistent component of his evening meal. The practical fix: use Parmesan, freshly grated or shaved from a block, as a finishing element on vegetables, salads, or soups. A small amount goes a long way, both in flavor and in glycemic buffering, and its near-zero carbohydrate content makes it one of the most freely usable cheeses for anyone monitoring blood glucose carefully. The fifth cheese I want to address is one that sits at a slight crossroads and requires the most nuance, and that is Greek feta, which many people believe is lower in fat and therefore a safer blood sugar choice than harder cheeses, when in fact, the comparison depends on what question is being asked. Feta is a brined, soft cheese made from sheep's milk or a sheep and goat combination. It has a low glycemic index and a meaningful protein content. The sodium in feta is worth noting. It is higher than in many other cheeses due to the brine, which makes it relevant for anyone managing blood pressure alongside blood sugar. But for glycemic management specifically, feta performs well. Its fat and protein combination supports gastric emptying delay, and its application in Greek-style salads, paired with olive oil, cucumber, tomato, and olives, creates a low glycemic meal framework with documented cardiovascular and metabolic benefits. A woman named Irene, a former marine archaeologist who had spent decades working in Greece and who had maintained a deeply Mediterranean diet long before it was discussed in health circles, came to see me at 71 with blood sugar management that was, frankly, better than most of my patients 20 years younger. She ate feta several times a week without concern, pairing it the same way she always had, with olive oil, vegetables, and a small amount of whole grain bread. Her approach was intuitive, culturally embedded, and metabolically sound. The practical fix: use feta in small amounts, 1 to 1.5 ounces per serving, in Greek-style salads, on roasted vegetables, or crumbled over eggs. Be mindful of total sodium if you are also managing blood pressure, and choose the lowest sodium feta variety available, or rinse it briefly before use to reduce the surface brine. Here is what I want you to do with what you have just heard. If you have been avoiding cheese because of blood sugar concerns, I want you to reconsider that choice with the specific information you now have. Aged cheddar, cottage cheese, fresh mozzarella, Parmesan, and feta are 5 cheeses with near-zero to very low glycemic impact that, eaten in appropriate portions and in the right food context, support rather than undermine glucose management. Starting this week, I want you to reintroduce one of them, whichever appeals most to you, as a deliberate daily or near-daily component of a meal or snack. Pair it with vegetables, low glycemic fruit, or olive oil, rather than with high glycemic carbohydrates. Monitor your blood sugar before and 2 hours after, and bring that data to your next appointment. Let your body show you what the research already suggests. The goal is not to eat more cheese. It is to eat the right cheese in the right context, with confidence, rather than unnecessary avoidance. Everything I have shared today is meant to support a conversation with your own physician or diabetes care team, not to replace their guidance. Your specific blood sugar targets, your medications, your kidney function if relevant, and your overall dietary picture all shape what the right approach is for you individually. Please bring this framework to your next appointment. And if rethinking which foods are genuinely helpful versus genuinely harmful for blood sugar management has you curious about what else you may have unnecessarily given up, the next topic I want to explore is the glycemic truth about nuts and seeds, and which ones the research now consistently identifies as protective for adults managing prediabetes and type 2 diabetes after 60.